the question is about infection in children and how we prevent transmission, chains of transmission from children and from parents. Thank you for this question. So there's some very good studies and research that are being conducted in children to better evaluate what is disease caused in children, what does infection look like in children, how many children are infected, and what does transmission look between children and between adults and children. So with regards to transmission, there are some studies that are looking at the fact that children can be infected, and we know that children can be infected. Children can be infected in their households if they're infected through contact with an infected parent, and they could be infected in other locations. You mentioned something like public transport. This virus needs people to transmit between. So if children are near an infected person, they can be infected. So there's a number of measures that adults and children, that all people can take to prevent infection. And it's the same for adults, it's the same for children. It's physical distancing of at least 1 meter. It's wearing a mask where appropriate, where you can't do physical distancing. It's cleaning your hands with soap and water or an alcohol-based rub. It's practicing respiratory etiquette. It's staying home if you're unwell, following your local guidance. As it relates to schools, and I know there's a lot of interest in the safe operation of schools, this needs to be conducted in the context of communities, because schools operate where communities are. So if transmission can be controlled in the community, and the DG has outlaid a number of ways in which that can be done, which includes active case finding, isolation and care of known cases, contact tracing and quarantining of contacts, and then all of the measures that I just mentioned, children can participate in that as well. So it's very important that we follow all of these actions so that we prevent infections in adults, so that we can prevent transmission onwards to children. The last thing just to mention is that while we don't have a complete picture of what transmission looks like within children, there appear to be differences by age and by age group. And it's very important that we look at children by different age groups. The youngest children, those under 5 or so, those that are in their elementary school years, those that are a little bit older in their adolescence and teenage years. It appears that teenagers can transmit more often compared to the younger children. So we're still learning, and we're still learning, and we need to do everything that we can to protect ourselves from getting infected and to prevent our ability to transmit to others.
Dr. Kelly will